Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, it's time for two popular updates. One will be health care, and the other one, well, it wouldn't be Pennsylvania Newsmakers if we wouldn't have a bit of politics in what we do. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host.
Hi, welcome back to the program. Terry Madonna here, and as always, thanks for watching. Well, I tell you what, Pennsylvania has the third oldest population in the country. I think now West Virginia has surpassed us as a proportion of the population. And guess what? We're getting older. We might not be able to do much about the getting older part, but we can certainly do a lot about how we handle folks when they get old, and we're all getting old. And I couldn't have a better guest joining me today to discuss the problems of the aging, the healthcare problems of the aging, Dr. Stuart Shapiro, who joins us for the first time. He's the new president and CEO of the Pennsylvania Healthcare Association. Dr. Shapiro, welcome.
Thanks, Terry. It's a pleasure to be here.
Well, now, look, you're going to be on the hot seat a lot on this program. You're going to become one of our resident experts. We're delighted to have you on. And what a background. You were Commissioner of Health for the City of Philadelphia. You worked for the United States Senate, giving the Senate health care advice. You were the Deputy Health Commissioner in the state of Massachusetts. And I won't get into all the teaching. As a professor, Harvard Medical School, Harvard School of Public Health, the Wharton School in Philadelphia, and, of course, the Georgetown University School of Medicine. So you've got a wide and varied career. Has that helped you doing all these different things, you think?
Oh, it's helped me tremendously. And that's, in fact, the reason I've assumed these new responsibilities. Yeah. I've spent my life as an advocate. And now that I'm right on the leading edge of being a baby boomer, some would say I'm over the leading edge.
Oh, I know. We're been there and feel that way. Go ahead.
There's no issue more serious that's facing the elderly today, and in fact facing our whole society today, then how are we going to provide ongoing health care to the people of America, and particularly Pennsylvania? And you're quite right.
But not to interrupt you, but I mean, one of the reasons I like guests like you is you're just not an ivory tower academic. I can say that. I mean, you spent a whole, you've got a spectrum of activity that you've engaged in that I think will help us understand a lot of these healthcare problems.
No question. I've also practiced medicine, and to have taken care of people who are older and who are facing real serious health problems. And because, thank God, we've got new medical technologies, people are living longer. Yeah. They're being healthier longer, but they also are going to need a lot of ongoing care at whatever age they begin to go downhill.
And one of the things we have found out, if you look at the cost of health care, it rises as you get older, but boy, when folks get to be 80, I mean, the line just goes sharply vertical, I guess because of the tremendous amount of, medication that's needed, the need to see physicians more regularly, the use of the modern technology.
The majority of our health care expenditures happen in the last few years of life. And that's because we've got such fabulous life-saving technologies which are being expended to keep people alive and as productive as long as they can.
Well, let's go to the heart of the matter, and one of the things I want you to talk about is we're getting older, we're living longer, and at some point, some pretty big decisions have to be made about how you handle, the elderly who probably can't take care of themselves, and it may be a little more difficult to do it in the home. And there is a big debate about where the medical care ought to be delivered as we grow older and less able to do so. Give us your philosophy about that.
Sure. And let me talk about a continuum of care. You or I are absolutely able to live independently today. We don't need any help. We can do it, and we have loved ones who we want to be with. But let's move beyond that. There's going to be people who are going to, later in the stages of their illness, going to be requiring institutional care. There's no question about that, and with an aging population in Pennsylvania, we're the second highest in percentage of people over 85. It's our fastest growing segment. We need nursing homes, and we need high-quality nursing homes in Pennsylvania that are adequately funded by a combination of state money, federal money, and private money.
And they're licensed, exactly.
Every one of them is licensed. There's about 700.
So they have to go through meet a set of rigorous criteria in order to keep those licenses?
Very rigorous, very high quality, They're inspected often, and they have to meet a set of standards. And so nursing homes are very important. On the other hand, there's a spectrum that says many of these same people at an earlier stage can be taken care of at home. And they ought to be taken care at home where life is much more comfortable for them. There's no one who doesn't want to be taken care of at home, but at some point it becomes either physically impossible or just plain too expensive, because you can't create individualized nursing homes in everybody's home. And so we have to have a continuum of care that starts with care at home, then goes into assisted living, and then goes into nursing homes.
Let me ask you a question about the in-home care. I mean, as you point out, for some, in some cases, that's certainly more desirable. But you do have to have, even in the home, people, you know, who obviously learn a little bit about the condition of their family member and are prepared to provide that care. Otherwise, there's some danger that they won't get the proper treatment. Maybe not because the people don't care and don't want to provide it, but, you know, this is tough, and it's technical, tough stuff, and it's technical. And doesn't that also play a role in the thinking you're thinking about this?
Absolutely. And there are some who can receive some care at home.
Yeah.
But at some point, and it often happens earlier and sometime late in the disease processes, people need real specialized care. And while some of it can be provided by nurses coming into the home,
right, that's true.
And it can be,
yep.
You eventually need to move, or you often need to move to a nursing home.
All right, we're talking with Dr. Stuart Shapiro, one of our new resident experts on health care. We'll be back for the second part of the interview with Dr. Shapiro after these words.
This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania, and by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. I'm chatting with Dr. Stuart Shapiro, the new president and CEO of the Pennsylvania Healthcare Association. We're talking about problems of the aging and, you know, particularly the healthcare. The problem with this aging is he wants to play more golf. I don't know what Dr. Shapiro runs, but he does. We're not going to let him run anymore. Knees, what parts of the anatomy, right?
That's exactly right.
Knees. They're hard on knees more than anything else.
Certainly running is hardest on the knees.
Oh, yeah. We've got those bicycles.
And the back.
Yeah, in the back. All right, let's go to the funding for this. Basically describe the funding sources. You know, when people are making these decisions, we got lots of folks out there making these decisions about what to do with their parents or their relatives. What do they do?
Well, people first and usually are using their own money.
Okay.
And in Pennsylvania, about 10 or 15% overall of funding is from private individuals,
okay.
Private pay. Medicare pays for it for a limited period of time, and usually for those that are coming out of the hospital or much sicker. In fact, nursing homes are becoming what hospitals used to be, because in many, many nursing homes, they've got subacute units, or units take care of people.
And they want you in and out of hospitals much more quickly, and so
they come to nursing homes,
sure, where they can still get good care
and get rehabilitated, and then go home.
Right.
But the third and largest funding across the state, in fact across the country, is Medicaid. And Medicaid covers more than 50% of the funds in nursing homes nationwide, and again in Pennsylvania. And it's very, very important that those funds continue. Now, Governor Rendell and the legislature have been terrific on that, at least in this current year, and they have to continue to be. On the other hand, the federal government has been diminishing the dollars in their attempts to balance the federal budget, and it really shouldn't be done on the backs of the elderly and the poor.
And we've had, you know, we did a whole series of programs on the $10 billion in Medicaid cuts, and we've had the governor on and other legislative leaders who've made arguments that, you know, they're desperately trying not to go too deeply with the cuts. Now, they did limit some services, how many times you could go see a doctor, and I think they put some limits on the prescription drug use, but they were determined not to cut eligibility to Medicaid.
And I think that's been the case, but the benefits that and the amount of payments under Medicaid, the Bush administration, and I'm not trying to be critical, the Bush administration has made a clear policy decision to cut Medicaid.
Right.
And fortunately, the legislature here in Pennsylvania and the governor have chosen to take the alternative tact, and that's very important, because if we're going to maintain the quality of care in Pennsylvania, and you did a poll on this, people believe that if funds are cut, quality will deteriorate, and frankly, we need to maintain those funds. Otherwise, we're not going to be able to take care of people who really need the services.
Now, let's talk specifically about, okay, we had the Medicaid part of it, but there's been this ongoing debate about, you know, where the state's money should go. Should more of it go to nursing homes, or a certain percentage of it? Should a certain percentage of it go, you know, into home care, which we just talked about? Now, as an incoming president, what is your philosophy? I mean, obviously you're going to go make the argument you want enough money so nursing homes can do what they need to do. Give me your general philosophy about that.
First of all, people ought to have choices. And people who want to stay home ought to have the ability, if the care can be provided there in an appropriate way. Now, we've established a policy that the state government and the federal government are going to pay for nursing home care. There are those who want now to expand Medicaid to the home setting and for the elderly. And I am 100% supportive of that for those that it's appropriate. But it's basically a new entitlement. And we as policymakers have to say, yes, that's a new entitlement. Let's expand it, but make sure we don't cut for nursing homes. Because you can't take from Peter to pay for Paul. And it is a new entitlement, and let's just be clear and direct and honest. If people want to do this, we're supportive, but let's increase the dollars, not try to take them from nursing homes.
And that's sort of the argument that the schools have about, you know, if you want to go expand into new programs, they're not opposed to it. If you want to require the schools to do, you know, tutors or additional help for folks who have special needs, that's fine, but don't take it out of the, you know, continue to support the base. Look, this has been a fantastic update. Now, we're going to get you back in here from time to time when we have just sort of general problems that we need to deal with. Healthcare is a major item of concern on Pennsylvania Newsmakers, and we'll get you back when we have some other important topics we want to talk about. All right, when we come back from healthcare to politics, a good bit of politics in the healthcare business.
Not much.
Not much, no. We're going to have, as always, one of our great guests, Fred Anton, who's going to come on and give us a quick update on the big issues, political and governmental issues that both face the legislature and face the state in these upcoming elections when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. Now, joining me, as often is the case, is Fred Anton. He's the president of the Pennsylvania Manufacturers Association. He's also had some activity off and on in the Republican Party over the years. Fred, let me just start with, I think, one of the big stories so far this month has been the pay hike, and it is reverberating throughout the Capitol. It still reverberates. Last week, the pink pig made its reappearance, you know, the inflatable pig, to make the point about what's going on in Harrisburg. What's your sense about the reaction to the Supreme Court's decision in the pay hike?
Well, I think really the issue has not been properly defined in the media, Terry. I think the question, really the ultimate question is, should the judges be adequately paid, and how should they receive their compensation? I think it's very important that the judges receive the increase in compensation that the Supreme Court decision will give them. I think that Justice Cappy, and Justice Cappy probably, speaking to the Philadelphia Chamber, wasn't the best person to defend the increase in compensation.
Because he played a role in the whole...
Yes, but what Justice Cappy said is correct. The judges are paid too low in relation to what high-quality graduates of major law schools are making. They should be paid, and to lump the judges' compensation with legislative compensation, it's a whole different situation.
Now, the essence of this, for you viewers, just as a reminder, is that the legislators, July 7, 2005, increased their pay, the pay of people in the executive branch, including the governor, and the pay of all the judiciary in this state. They then rescinded it, and there were some court cases, and a big court case involving whether or not the judges who had their pay hike rescinded by the legislature would get their pay or not because of a provision in the state constitution. All right, Fred, let's just go on now. Look, I happen actually to agree with you about that. But the problem, now tell me if you think I'm right about this. The problem is the judicial pay hikes ought to not be considered with the pay hikes for the legislature and the executive branch. Why are these separated out? Why do they link them together? Why shouldn't they be separate?
They should be separate. I do agree with you that they should be separate. They should not use the same standard. The evaluation of the judge's salary ought to be different. The reason why they hook them together is because the legislators and the politicians thought that that might be beneficial for them getting their pay. Now, in this legislation, it couples the judges' salaries with federal judicial salaries going forward.
Does that make any sense?
That makes a lot of sense. It really does. That is the way to do it.
And that way, they're pegged to the federal judges, and the legislature doesn't have to get into the politics of it with the judiciary? Is that
That's the idea. In other words, the idea is some standard where the judges' pay will be kept current, but it won't become a political issue within the state.
I'll tell you one thing. If the legislature had just hiked the pay for the judiciary, there would have been a whimper, not an outcry. Do you agree with that?
I agree with that totally.
A whimper.
The issue here was the legislators raising their own salaries excessively and taking the raise in clear violation of the Constitution.
Okay. All right, I want to get into the legislature is back. I want to get your sense after a quick break here about what you think the legislature is going to do. Got a couple of big issues before them, and then who knows when they go into these infamous sign or die sessions, which Fred Anton will explain after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program with Fred Anton, the president and CEO of the Pennsylvania Manufacturers Association, and often a guest on the program. All right, Fred, legislature is back. Gaming, the special session on crime or the special day on crime. Is the legislature going to do anything, or are they going to wait until after the election?
Well, Terry, let me say this. This is very unusual. At this time, usually, the legislature tries to focus on the election, and they try and let the members be home in their district. They've got some big problems here with the Pennsylvania voters, and this gambling is a very, very volatile and a very, very serious situation. The fact that legislators and public officials can own 1% interest, that's very susceptible to all sorts of corruption. And they've got to get this middleman provision straightened out. And they really ought to do away with the way they require unanimous votes among the four caucus appointees. In other words, they've got some...
So you think, the bottom line here is you think gaming, all the reforms that have been proposed will are something that they're likely to do before the election?
Well, I think it's something they should do before the election. I think it's something that can be a major issue in various legislative
you're right.
districts.
You're absolutely right about that.
I mean, it is a very hot issue. Now, going to the second one, I mean, I think John Purcell, I admire him
Speaker of the House, John
for proposing additional police. Everybody's jumping all over this. The crime situation, the murder situation.
Particularly in Philly.
And particularly with guns in Philly. I mean, this is a major dissatisfaction.
Well, they're going to have that one day called the Committee of the Whole, where they're going to debate all these gun control and other measures.
September 26th.
Yes, sir.
September 26th. That's what you're speaking.
And though they're not going to pass legislation, they'll get a sense about where the legislature might go. But, you know, if we get back into this issue of gun control, you know, this state traditionally has not been a strong gun control state because it's overwhelmingly rural and, lots of hunters. NRA is very strong. Are you optimistic that there'll be some crime legislation passed?
No, I'm not. I'm not optimistic at all. I think it'll result in gridlock. I think the NRA is strong enough in this state
to prevent it?
To prevent any more gun control legislation. I think that they should allow Philadelphia City Council to legislate on handgun use.
Okay, so you think Philadelphia ought to be able to legislate for itself?
Yes, I do.
Now, I don't want to run out of time, but I want to ask you this whole issue about the so-called sessions that take place after the election called Sign or Die, where they put off a lot of controversial things after the election, then they do them often late at night, often hurriedly. What's your sense about that?
I do not think there will be a sign or die session. I think that the public outcry over the pay raise and the public outcry over the process. Many more of the leaders are recognizing. Vince Fumo said something about the process. This process is unacceptable. It's unfair to the voters to do these things in the middle of the night. And they're going to have to change that. They are, Terry. And I think they'll be afraid in the sign or die session.
Well, we're out of time. I wanted to get to Rendell Swan, but basically we see no change in the environment there, in the political environment. The race seems pretty much stuck in place with Rendell. We're out of time. You agree with that?
Yes, I do.
All right, there you have it. Fred Anton gets the last word. We'll see you next week for another edition. Stay well.